Every year in October, we take our mark, get set, and go in the race for a cure to breast and prostate cancers. Tonight, we bring you the latest in medical breakthroughs and cutting-edge medicine used to help win the race. The Aware Show starts right now.
This original WSRE presentation is made possible by viewers like you. Thank you.
Hi, I'm Dee Dee Sharp, and welcome to The Aware Show. We're glad to have you right there with us. Today, we feature cutting-edge medicine in breast cancer in women and prostate cancer in men. Coming up in just a moment, we'll be talking with cancer survivors who share their stories, and we'll have medical professionals here to share the latest information with you, including early detection, prevention, diagnosis, and treatment. To that in just a moment, but first, some statistical information to help you break it all down. According to breastcancer.org, about 1 in 8 U.S. women, that's about 12%, will develop invasive breast cancer over the course of her lifetime. More than 40,000 U.S. women are expected to die by the end of 2017. Another important fact here for you, breast cancer is more common in African American women than in Caucasian women. I want to turn the pages now for you to prostate cancer. About 1 in 7 men will be diagnosed with this during his lifetime. Prostate cancer develops mainly in older men. The average age at the time of diagnosis is usually about 66. It is the third leading cause of cancer deaths in American men behind lung cancer and colorectal cancer. About 1 man in 39 will die of prostate cancer, according to research. Now, we do want to make you aware of this. The American Cancer Society is reporting some good news about breast cancer we want to share with you. Death rates have actually declined almost 40% between 1989 and 2015, averting an estimated 322,000 deaths. The reduction is attributed to screening and early detection by self-exams, mammography, and improvements in treatments over recent decades. On this edition of The Aware Show, as I mentioned at the top of we're going to focus on the diagnosis, treatment, and prevention of breast cancer. Plus, we'll explain the latest technology and cutting-edge medical breakthroughs as we race for the cure. Joining me in the studio to do all of this, we have, to my immediate right, here from Baptist Hospital, Dr. James Adams, radiation oncologist. To his right, Nikki Jordan, mammography technologist. Next, we have Iris Velez, breast cancer survivor. To her immediate right, we have Leonard Pritchett, prostate cancer survivor. And last but certainly not least, we have Hester O'Rourke, RN, former president, National Black Nurses Association, and Big Bend Chapter Sister Study participant. Thank each and every last one of you for being here for The Aware Show. I know that there's going to be something that you're going to share with us that's going to make our viewers more aware of prostate and breast cancer, being survivors, and having the information that they need to either pass along to a neighbor, a sister, a friend, someone they know, perhaps even themselves. So this information is very pertinent, and I thank you all for spending your time to share it with us here on The Aware Show. Dr. Adams, all eyes on you. Questions. What is breast cancer and what is prostate cancer? Start there first.
Okay, starting there. I think the easiest and one of the best ways to think about it is that it's part of the normal cells of the body that have gotten out of their normal control mechanisms. Part of the breast cancer, part of the breast, the cells they have normal ways of keeping themselves in check, and for whatever reason, aging, outside influences like radiation, I think, certainly other things, they get out of control. They lose those checks so that they grow in the breast, for instance, or in the prostate, and they also, at some point, will spread.
Okay. Is there anything you want to tell us right off about our friends who are survivors here joining us on the Aware Show before we get to their stories, because we really want to hear what they have to say as well about their experience and being survivors.
Yeah.
I love that.
Yeah, I really thank y'all for being here, and thank you for having me here.
Of course.
These two have been
Can you
through.
tell us a little about their medical? Yeah.
Well, okay, we have a breast cancer survivor, Ms. Velez, who has gone through, I believe, about everything you can go through. You've gone through surgery, you've gone through chemotherapy and radiation, which are the three major ways that breast cancer can be treated. And she's doing very well, I think, handling things great. And then we have Mr. Pritchett, who has gone through radiation for prostate cancer, and he's got a great attitude, and he's going along strong.
All right, sounds great. Coming from your doctors, your doctor. We're going to start with ladies first. Beautiful young lady here joining us. Please tell us about your story. Tell us about your story from diagnosis to where you sit here this evening on the set.
Well, my journey started in August of 2016, having my regular morning jog with my husband, and I wasn't yet due for my mammogram, but being a little jogging every morning, I had this little a weird sensation in my on my nipple, but I blamed it. It's runner's nipple. It's probably just irritating my clothing is just irritating my skin. I let it go because I figured nothing to it. I just rinsed my clothes, and I thought it's going to go away. At the end of the week, I was still having that discomfort, which made me call my primary doctor, because I figured, well, he'll just call, maybe set up, maybe have my mammogram done before then. And he did. I went for my mammogram, and sure enough, I was diagnosed with, at the time, with triple negative breast cancer. The rest is history. At that point, the second I heard the word cancer, and I'm going I just went into panic mode. It was just like, okay, I didn't feel it, didn't know what was going on. Panic mode set in, and all I wanted out. If somebody has to go to surgery tonight, just to take me there and then take it out. Again, I just went into like panic mode. Once I relaxed, then the team got together and they told me what my choices would be. Of course, the biopsy is going to confirm everything, and how advanced it would be and stuff like that. The biopsy did confirm that it was, malignant cells. And then my choices were, I can have we weren't sure of the size yet, so it was either a lumpectomy. Of course, there's always possibility for the mastectomy, depending on the size. And I just chose my surgeon, and he decided the mastectomy was the way to go. Then after that, I just left it in my oncologist's hands. I think I had the best. I have,
if we don't say so ourselves, he's absolutely the best.
I had the best. So
okay.
The rest is history. I had my mastectomy. Mm-hmm. The recovery went really well, and then I had my chemotherapy, followed with the radiation.
Cancer-free now for?
Cancer-free for 8 months now.
Woohoo!
Yeah.
And counting.
Yeah, and counting.
Winning the race.
But on that note, I wasn't due for my mammogram, so you have to listen to your body. If there's something that's not normal, that just doesn't feel right, don't ignore it. It's better to go have it checked out and have them tell you.
Yeah, don't try to be your own doctor.
Don't try to be your own
diagnose
doctor.
it.
Just have it go ahead, and I'm really grateful for that, because my primary doctor did say, you know what, the nipple pain doesn't sound right. Let's get this taken care of. So just listen to your body and do everything that you have to do, because I'm here now. It's cancer-free.
Makes a difference.
Yeah. Yeah.
Very good, Leonard. Prostate cancer survivor here on the Aware Show.
Yes, ma'am. mine actually started, I was diagnosed in October of 2015, but my story kind of actually starts 2 years before that because my PSA level, which is the level that they use to diagnose prostate cancer, would fluctuate. And there's several reasons. Dr. Adams can go more into that as to why your PSA level will fluctuate. Well, in 2013 and 14, it would go up. They would put me on antibiotics for 30 days, and it would come back down. Well, in 2015, it was back up again. So I made the decision and went to my urologist and said, look, I'm tired of this, and the only way to know for sure is a biopsy. You know, so let's do the biopsy, put me and my family at peace of mind. If it comes back malignant, so be it, we'll deal with it. If it doesn't, we can treat whatever's causing it. Well, lo and behold, in October 2015, they done the biopsy, and it came back hot. And I was told most gentlemen, it's either hot on the left side or the right side. Mine was both sides. So they put me into a higher risk because of that, and the fact that it had been fluctuating for 2 years before then. And like Iris said, the big thing then is treatment. And you know, that's the hard part really, because when he walked in and said, Mr. Pritchett, got news for you, it's not good, you've got cancer. Felt like it sucked every bit of the air out of my body. You know, it's hard, it really is. And even though my wife was there, and you kind of halfway expect it, and you can talk about it, but when you hear the C word and it's in your body, you know, you just can't comprehend how you feel. I mean, I'm sure Iris would agree that no matter how prepared you are, you're never really prepared. Not at all. But then, like I say, did the treatment, and they told me I could do nothing. You know, I was 62 years old, so I guess I was a little ahead of statistics. But
I love that.
You know, my family pretty much said, doing nothing, that's not an option. You know, we're going to do something. So I was like Iris, first thing in my mouth was, cut it out, right now, cut it out. So I didn't even hear the radiology part of the conversation. Yeah. So I was like her, after I left his office and I calmed down and me and my wife talked, and you know, it was like, okay, we need to explore the other cures that we can use, because each one of them has their own side effects. So I went to see Dr. Adams. I'm sure glad I did, but he really, I guess by then I had settled down enough where when he explained the pros and cons of surgery and radiation, it finally, I grasped it. And that's when I decided to go with radiation. And I think 48 treatments later, I finished up, I think, May of 2016. He declared me a survivor in October of 2016. So I've been cancer-free now almost 18 months. He still has me on 6-month protocol, but hopefully in April he will get me off that where he doesn't have to see my smiling face every 6 months. But
We'll talk about that.
But if I could say anything, I would tell, especially, well, the men, obviously, that it takes 10 minutes to get a blood test, you know, and when you get to that age, you know, it's senseless.
Yeah.
It's so easy, you know, and that's essentially saved my life.
Right.
Because it's like you said, cancer, and it can spread. You know, there's no guarantee. And you hear, well, prostate cancer is not that bad. You know, it's one of the, no. Anytime cancer gets in your body, it's bad. So You know, the big thing is I can always tell my friends and all is, you know, get the blood test. It doesn't hurt.
Okay.
You know, it puts you in the ballpark. Then you can decide, you know, what you want to do. But at least you got some way of knowing where you stand, because it can kill you in a minute.
Okay. Tell us a little bit more about, Dr. Adams, how you were able to do the treatments and that sort of thing. Can you tell us a little bit about that?
There's probably 44 treatments.
Oh, 44, excuse me.
But, you know,
Felt
when
like
you come
100.
in, you look at several factors as to whether or not you need to get treated in the first place. Age is certainly one of them. If you had been, well, I remember the particulars of your case, but if you had been 80, perhaps, you know, we wouldn't be treating you, or even 75. But at 62, a relatively healthy gentleman, I think that it made a lot of sense to do that rather than active surveillance, which is what many men elect to do. In your case, it made a lot of sense to treat you, so we did some tests to make sure that the cancer had not spread, made sure that it was all contained. It wouldn't make sense to treat you locally if indeed the cancer has spread.
Okay.
And once we had done that, we knew that you were, you know, a curative patient, and we decided on external radiation, which is what you got, a series of close to, you know, 8 weeks.
Okay, very good. Want to get some of the other guests here on the set involved here. We know, Hester, that you're a part of the sister study, and we can go in depth with that. But what I want to just kind of scratch the surface with is very important, what's going on with you. Your mother was diagnosed with cancer and died, and your sister was diagnosed with cancer and survived.
Yes.
You can pick it up from
She
there.
had bilateral breast cancers and mastectomies. And she also had lung cancer and had a lung removed. And she's doing really well now. So that's been at least 15 years. And she's just magnificent.
Yay! So it's been 15 years
Yes,
and going.
yes.
That's good. What's it been like for you knowing that you lost your mother and your sister's been diagnosed? I mean, and there, you know, there you are, in the middle, kind of.
Yes.
In between all of this. What's
Well,
it
I
been
have
like?
a daughter, and she has been having regular mammograms since she was in her early 30s or late 20s. And when she went in, they were saying, no, you're too young. And she insisted, she's her own best advocate.
Good.
She insisted. With my grandmother with breast cancer and my aunt with breast cancer, I want to make certain that I'm taken care of. So she's really good at that. And my son, because my husband also had cancer, so I'm saying to my son, even though he just turned 53, that he needs to have the prostate testing done. So we're really into getting the testing because we've been told, or the statistics show, that because of a racial component, that we don't seek treatment, or we're not treated in the same aggressive way as others.
May not have
So,
insurance,
well,
can't afford.
in our case, we're lucky. We do have insurance.
Okay. Well, particularly
But-
for
yeah,
you. Yeah.
But
I was talking about in general.
Yes, in
yeah,
general.
for sure.
But you know,
Yeah.
we really do have to advocate. And with my group now, every October, we call 5 friends and make certain that they have their mammograms done, so that it's
Good.
become one of those things that just, you know, becomes a networking, netwebbing kind of thing.
Okay, very good. I too lost my mother in 2000 to breast cancer, and so I have to do regular mammograms. And I always say, because of her death and her dying, it gave me a chance for a cure, because at least I know to get tested and to have my mammograms annually. And that brings us kind of to you as well. Vicki, you can tell us a little bit more, and we'll show some video, and we'll go through that in just a moment. But just kind of want to get you involved in the conversation today from what you see from patients who do come in and get their mammograms. Can you tell us a little bit about that experience for them?
I know a lot of people are afraid when they come in. They're worried if it's going to hurt or be painful or whatever. And we, as technologists, we just try to assure them that we try not to hurt them as best as we can, but, it would only be for a couple of seconds and it's worth saving your life over. We just try to reassure them. And, a lot of people are afraid because what are they going to find out? This mammogram is going to tell them one way or the other. Do I have cancer or don't I? We try to keep them calm and say, just wait, till we get the results. And if there's something there, we'll worry about that and cross that bridge when we get to it, kind of thing.
Okay, very good. And you're so delightful, I can tell that someone comes in for something that can cause so much anxiety that you have a way kind of smiling some of that anxiety away. So glad you're where you are doing what you do. I want to turn to you, Iris, again, because some of the risk factors at the top of the show, we talked about African American women being at a high risk at an earlier age, and cancer being, as I know Dr. Adams would say, echo my saying that it can be more aggressive in African American women. Mm-hmm. You are?
I'm Hispanic.
Hispanic. Mm-hmm. And the age of diagnosis?
65.
So there you
65.
Okay.
And in my case, I don't know my father's history, so I don't really know if there was any cancer on my paternal side. But on my mother's side, there's no cancer. There was no cancer. There was no reason. So when I was diagnosed, that was like a slap in the face because that was the last thing on my mind. I've never been sick. I don't smoke. I try to eat healthy. So they just came out of left field. So.
You talk about slap in the face. I know, Leonard.
It was the biggest fear, yeah.
I can imagine. And thinking about Leonard, guy thing, prostate cancer. Nobody wants to talk about that.
No, ma'am, they don't.
Nobody wants to talk about cancer anyway, but I'm just saying, men.
And that's one of the things I talk to my friends and stuff, and it's a guy thing. It's like sometimes you don't want to know. I can handle it, right? Well, like she said, I'd never had history of cancer on either side of my family. It came totally just like hers, out of left field, that I was the only one that had it.
Okay.
But, I just can't reiterate enough that to get it done, get the test done, because, it's put your ego in your back pocket for a minute and think about it. Not only you have a family, sure. You have children, grandchildren. I'd like to see my grandchildren grow up and have great-grandchildren. So just take that time, get it tested.
Good. That's good advice. I know it's something important that you alluded to had to do with statistics. And we do give numbers at the top of the Aware Show. And that was just to put a perspective on things. But I just want to remind you that those are just numbers and statistics. That you guys are proof that you don't fit those statistics at all, not even having history. Certainly that might make, and Dr. Adams, you could speak to maybe that might make you a little bit more at risk or more susceptible to it, but it doesn't mean that's by any means the standard.
We always stress family history, age, things like that, but I would say the majority of patients that I see do not have a strong family history. Mm-hmm. So every patient, they come in, we need to be aware of those things as to when you start your mammograms, when you start PSA screening, you need to be aware of your family history. But at the same time, as I said, most of the patients that I see don't have that. So you need to be your own advocate and
sure.
Talk to your doctor is really the bottom line about getting these tests done.
Now we say that, and then tongue-in-cheek, we go to statistics. No, I'm just kidding. We go to risk factors that we were able to do some research and here on the Aware Show, just to kind of share with you, because these are things that are important and relevant, but not necessarily, the benchmark. Not right. Let's talk
Yeah.
just a little bit about this. Breast cancer risk factors: older women, family history, obesity after menopause, excessive alcohol, smoking, diet, radiation exposure. Any of that just jump off the screen?
Like we're saying with cancer, the older you get, the more susceptible your DNA is to damage, and that's really the reason that people get cancer when they get older. And, that as well as external factors, whether it's obesity, that's something you can do to help control things. There's a lot of things that you can do. Staying active. I do have some patients who've come in and they say, well, I've been taking this vitamin and I've read that it's going to prevent my cancer. Well, it turns out I've had a few patients who were taking a certain vitamin and it may actually be a causative thing, but I think the normal things that you can do, the things be healthy, be active, have a healthy diet, low fat, those are common sense things that we know pretty much help reduce the chances. They're not going to eliminate the chances. You can do everything, in your power, and there may still be a genetic factor at work. There may be something we don't understand.
Gotcha. Turning now to prostate cancer risk factors. Just want to take a look at that as well and show you that on the screen so you can see what some of those are, including being an older man, your race, family history, obesity, and even your geography. Does any of that jump off the screen?
We were talking about it
Sure.
earlier, about age, and certainly the increased risk of prostate cancer as you get older. And like we were talking about, I think it is true that if you live long enough, a man will get prostate cancer eventually. If you were to,
we got to zoom in and focus on that. I don't mean to interrupt you, but I mean, that's just a real big one right there.
Yeah, so if you took 100-year-old men and did very sensitive biopsies, you would probably find some prostate cancer in those, in most of those, if not all of them. The question is, are they there just never going to declare themselves and become an aggressive cancer or not? So you really have to pick who has the aggressive cancer and who needs to be treated. Take the patient's general health into consideration and just go over options, side effects of treatment versus risks of just observing.
Gotcha. We'll get to some of the symptoms now if we can. We'll talk about that, and then we'll come back to Leonard and Iris and let them tell us about what, if any, I think they may have mentioned off the top some of what their symptoms were, but let's go to this. Including breast cancer symptoms are the following: lump thickening in near breast, underarm area, nipple tenderness, change in size or shape of breast, skin redness, scaliness, ridges, dimpling of the skin, and fluid discharge. Again, just some of the symptoms that people have reported, but not necessarily the only ones, which Iris has certainly attested to. Does any of that jump off to where you want to just kind of zoom in and focus on, or is
No,
that
I think it goes to the same point.
Right.
All of those could be symptoms, but they need not be sometimes. Sometimes you can, I think you were having regular mammograms, Iris, but I think the point goes back to getting mammograms so that perhaps you even detect it before those are found.
Very good. And lastly, on the graphics, we have what we would like to share with you in terms of symptoms for prostate cancer, and then we'll come back to our survivors and talk to them a little bit about what they may have gone through. Under this, we have trouble urinating, decreased force in urine stream, blood and semen, discomfort in your pelvic area, bone pain, and erectile dysfunction. And we
So,
just,
the point to make there, I
right.
think, is that those are symptoms that a lot of older men have separate from prostate cancer. If they have evolved to that point because of the prostate cancer, it can frequently be more advanced and need even more aggressive treatments. So,
Okay.
again, I'll go back and agree with you on the PSA. I think that's crucial. And
Okay, and we'll talk about the PSA, zoom in and focus on that, but I want to get back to you all, the survivors of breast cancer and prostate cancer, Iris and Leonard. Any of those come at you in terms of your symptoms? You may have shared a little bit of it with us a little early on, but just so that people understand that you being two people who did not have any of the risk factors, your symptoms, how they varied.
When I look at that and look at my health when I was diagnosed, like Dr. Adams says, there's a couple of them, but normally we chalk those up to old age, okay, or older age. As far as what to me would be the obvious symptoms, I never had any. It wasn't there that I recognize. And looking at the symptoms, it gets back to the man's ego. Because if you'll notice, some of the symptoms really play on a man's ego. So a lot of men, are going to chalk it up to something else just because they're a man. And, those are the ones that, may go for years and ignore, to me, obvious symptoms of it because they're men. So, but when it came down to it, the PSA was what saved me, and that's why I tell everybody, every year.
Get your PSA.
Get your PSA.
Okay.
Yeah.
Iris?
And in my case, I did the self-breast exams, I did my mammograms, but I listened to my body after a couple of days when my nipple, because that was not the norm, then I went to, maybe there's something going on. Again, last thing in my mind was cancer. But I thought to myself, it's been a couple of days, it's not going away, I better look into it.
Okay.
And so.
Hester, do you remember any symptoms from mom or your sister, anything that they talked about that they were going through?
Well, my mom was very secretive. She didn't talk about much. But I remember when I was a little girl and I saw this lump on the outside of her breast, and I said, "What is that?" And she said, "Never mind." So that was probably around the age of 6 when I noticed that, and probably, let me see, I think I was in my 30s when she was diagnosed and had the mastectomy. So it was quite a long period of time between diagnosis and death. So it was.
Kind of go ahead and zoom in and focus for us a little bit on the sister study and what that has meant, and then just kind of bring us up to date, if you will.
Well, the sister study started with siblings, one sister having had cancer and the other not. So they asked for DNA and environmental studies and all of that. And then they started doing Hispanic women. And it was the strangest thing. I was in Las Vegas in August, and I was at the show, and 3 women came in, and it was a mother and 2 daughters. And the mother and daughter had had cancer and had mastectomies. And I told them to join because they were looking for Hispanic women. And it's been a progressive kind of thing. So they've been doing all kinds of studies on different women and doing other cancer studies as well. So it's really been a very progressive study that they've been doing, and it's really been helpful.
Okay, and you're still, and how long will this be? What's going on with it, and how long will this be?
Well, it's an annual checkup and answering questions and that sort of thing. And they haven't asked for another sample of all of the different things yet. But when they did, it was toenails, fingernails, dust from the doors, and all kinds of environmental things. So they were really very aggressive in what they were studying to make certain that there wasn't a correlation between environment and cancer.
Okay, and this of course is being done by the National Institute of Health, or who's doing the sister study? Do you remember right off?
Let's see.
Okay, we're gonna let her get to that so we can share it. Hey, folks, this is what we do here on the Aware Show. We go get the information.
It's a study of the environmental and genetic risk factors for breast cancer, and the principal investigator is Dr. Dale Sandler.
Okay. Okay. Very good. All right. Want to bring you back in over here silently in the right ear, waiting patiently, Vicki, and we'll get to some video of my actually having gone and done a mammogram in our files here at the Aware Show a couple of years ago. Tell us a little bit about what actually happens in this process so that we can begin to help women who may be just coming into this and having them done, what they can expect when they come in to do a mammogram to be tested, and then we'll get to the PSA after that. Let's do that. We'll roll some video too, and you can tell us a little bit about what's going on in the video.
Okay.
Go ahead.
So usually the ladies will come in, we'll have a history form we have them fill out. We ask them questions about their family history and any problems that they might be having or anything like that. So our technologists kind of go through that information, and then we have the patient get undressed, and then we just take 4 pictures usually. It's pretty quick. Usually they're in and out in about 5 or 10 minutes. Real quick. There is some pressure that presses down on the breast, but it releases automatically as soon as the picture is finished. So it's just pretty quick and easy. Usually they're in and out total about 20 minutes. They're on your way.
Okay, and in this video you can see where I'm having this done. She's making some adjustments.
Yes.
Anything else you want to tell us about what's going on in the video we're looking at? Just getting ready to do a particular image or something you want to
Yep, in
share with
this
us?
picture, she's doing a side picture. We usually do a picture up and down where we're going from the top to the bottom, and then we change and do a side to side, and that enables us to see more. Now we're on to digital mammography, which is done by computer, and we actually have a 3D system at many of our facilities that do 3D mammograms, and not only does it take the regular picture, but it takes pictures in slices, and that way the doctor can see better. So it's better on ladies with dense breast because they're able to see the tissue better. It's the same time frame that it takes to do the other mammogram, and some great technology they've come out with.
Okay, now if they can just get to the point where the plate is warm. No, I'm just kidding. It's bad enough you got to take the pressure, but it's got to be cold too. No, I'm just kidding. Thank you so much for telling us more about that. Iris, tell us, you and or Leonard, how has this changed your life?
Oh boy. Well, I believe in always trying to find the positive in everything, and although I've always enjoyed life, I have always enjoyed life, but now I've learned to appreciate life. So I've learned that, you know what, tomorrow's not promised, so I'm going to enjoy today, and I'm going to wake up tomorrow and thank God that I'm still here and that I can still play with my grandbabies and stuff. So I've just learned to just appreciate what I have, the little things. It's just the little things.
I love it a lot.
Yeah, I tell people I don't have bad days, because if I wake up in the morning, it's a good day. Now my day may go downhill, but I don't have bad days. But you know, so much of, I think Iris will agree, so much of what we go through as cancer victims, survivors, whatever you want to call us, is mental. Mm-hmm. And I don't get in a hurry anymore. I don't stress about nothing. You know, it's not worth it, because like she said, I take one day at a time, thank God for that. And you live life. You know, you don't let life live you. You live life, because every day is a blessing. Mm-hmm. Because I'm not real fond of the alternative.
Right. Well, we don't know.
You know.
Fear of the unknown. And by the way, hats off to you. we recognize your hat. Thank you for your service.
Oh, you're welcome. And that was real quick. That was another thing. Doing what I did for that many years. It was hard because, you know, I was able to do what I wanted to. I could physically do. And then all of a sudden, you can't physically do stuff, you know, because Dr. Adams will tell you that radiation will eventually it beats on you a little bit and you get tired. You get tired. And I wasn't used to not being able to do stuff. I meant everything, you know. So that played a little bit, and there goes back to the mental thing where, okay, it is what it is. We'll make the best of it. We'll get through this. And with a good support group, your doctors, your family.
Oh my God, yeah.
You know, we couldn't make it without it. It's just that simple.
Okay. Well, we can let him do the Aware Show. He's so good. I love his responses. Dr. Adams, I'm turning here to you. We said we were going to talk about the PSA test. Tell us a little bit about that, and we'll go into some other treatments and things like that are available.
You know, PSA is a screening tool that's very good. It's also a little bit controversial because there have been some studies that showed that not everybody perhaps should get the PSA. The recommendations are that the patient talk to their doctor about the PSA. I'm an advocate of it. I'm getting PSAs myself, and I will continue to. I think it's a very powerful predictive tool, and it's got, as Leonard said, it's got its pitfalls. It can be falsely positive. It can also be falsely negative on occasion. But it is an important tool to
Blood
pick up.
test.
It's a simple blood test, yeah.
It takes about 2-3 minutes.
yeah,
Most of
whatever,
wait in the
yeah, it
office
takes
is
the
longer
time
than the
to-
test.
It takes longer to
You
get
wait
in
in
the lab
line,
than it does
yeah.
to draw the blood.
Right.
So-
Right.
But we'll typically get the results back in a day or two.
Yeah.
So.
Very good, can make a difference. Let's go ahead and take a look at the screen here, and we can take a look at some of what is going on with how to prevent cancer. If we have those screens, we can bring that up, and I'll share that with you for prevention. Here's what we have from our research. Exercise regularly, maintain a healthy weight, drink alcohol in moderation, diet, no smoking, self-examinations, and regular mammograms. Turning now to prostate cancer prevention, we're going to show you some of the prevention methods, including healthy diet, exercise, healthy weight, proactiveness, talking with your doctor, resonating here from the show, you keep hearing that, and prostate screening treatment. Of course, we're talking about that as well here on the show. And I guess the most important thing is doing these things that we keep making you aware of. You say, well, we've done this before, we've done this. But the most important thing is to just keep putting it out there, because we are making strides. We are winning the race. I mean, the numbers are showing that breast cancer is down from 1989 to 2015. And that's really great news for us. So we're doctors, you know, folks in the medical arenas and research, and certainly people like you all, the survivors who step up and talk about your stories. All this stuff is paying off, right?
Yes, ma'am.
Okay. And so going forward, Dr. Adams, what do we need to know about cancer, breast cancer and or prostate cancer? They probably already shared it, but from the medical standpoint, with breakthroughs and or the latest and greatest technology.
Yeah, well, I think that we're detecting it earlier, like you said, and we're also improving the techniques, both on, surgical techniques have improved. Chemotherapy has gotten less toxic and more targeted. Radiation is really, the move is to be much more targeted, so you get less collateral damage from the radiation, and that's really where things are heading. On the other side, I think that genetic screening, genetic testing, and they're going to be more and more targeted therapies as time goes on, giving us a greater chance for curing cancer.
Good. I think something that I heard from this side was that the fear. We talk about that. We have fear of getting diagnosed. We have fear of once you get the diagnosis. I mean, that seems to be the main word in all of this. I got the C, the big C, you know, and the fear that comes with that diagnosis, and the fear that comes going through it, and the fear that's after it, that can be even afterwards. Tell us a little bit about that from your perspectives.
Yeah, it's scary. I mean, I don't care, like I said before, how you prepare to get the news. Once you get the news, and then, you know, it's the fear, okay, I have it. It's the fear, will the treatment work? Okay? If this treatment doesn't work, where do we go from here? Okay? It's the fear of, will it come back? You know, I just saw Dr. Adams the first part of the month to do my protocol call, and my PSA had dropped a little more. And so, you know, it looks good now, you know, and I'm thankful for that. But you always, in the back of your mind, you know, you go, okay, well, what if it's 2.4 next time? Where do we go? What do we do? You know, and I think Iris will agree that that's why we live one day at a time.
Yeah.
You know, because there is that fear that it will return.
Yeah.
So
Fear factor.
It's just a fear factor, but you know, I chose to the warrior. It's almost like I've put myself in a position where, you know what, I'm not going to let the fear just bring me down. If anything, I'm just going to fake it till I make it. I'm just going to have a great time. I'm just not going to let this happen. I'm going to ask my questions. I'm going to make my phone calls. I'm going to talk to my team. I'm going to stay active. And of course, I'm going to try to be proactive, not to the point of becoming obsessive. Because I know it's like I go for a mammogram every 2 weeks if just to make sure that my other boob's doing okay. but I'm trying to stay proactive. Again, just listening to my body. If there's a question, you know what, I pick up the phone and I ask.
I love this.
Should I be doing this and stuff? So I'm trying to work with my team because I have to say this. I've got to say this. The team, my medical team, my family is what got me to staying positive.
Yes.
Staying positive.
Good.
And sure, it's okay to be fearful, but you can't stay in that mode.
No.
You know, you've got to fight it through, and you've got to say, you know what, I've got today, I'm going to enjoy today. So I make my phone calls, I ask my questions. I don't try to do a lot of reading, a lot of Googling, because sometimes that's not a good
That'll
thing.
get you.
That'll get you in trouble.
Yeah. So you ask the right people.
Talk about
You ask the
fear,
right
right?
people.
Bring your own fear.
And another
You know,
thing is who do you get mad at?
Hmm.
Because I know when I was told I had cancer, you know, it's like, okay, why me? Okay, well, who are you going to get mad at? You know, it's God, please. You know, your wife.
Right.
You know, your life. What, and it's just it's pointless. You're wasting more time on stuff like that than you are being positive.
You have to
And
stay positive, yeah.
that's it. Because without a positive attitude,
Oh, yeah.
everything that they do,
Will just be contradictory.
it'll be essentially, I'm not going to say worthless, but it will take it a lot longer. Because I know how when I went to Dr. Adams, that whole staff down there, I had no clue what I was getting myself into. And without them and my wife and my kids, there's no way. They keep between them and like you say, our support groups. That's what drives the bus. We're just along for the ride.
That's really good. I love it. Some great sound bites here, by the way. And I was going to go to Dr. Adams, but I got to just stay right here because Hester, we're talking about family support, and that was apparently the column that held each of these people up during all of this. Tell us a little bit about that for you, with being that column for your family and part of that support.
Well, my sister called me, and she told me, and, you know, we had our anxieties on the phone because she lives in New York and I'm here in Florida. And when she called me and told me, it was really devastating because our mom had passed away already. And just being able to talk to her and help her through what she needed to go through. And then she went for the augmentation surgery. And she was still smoking at the time. And having to blast her over the phone for that because it destroyed her tissue. And we went through some back and forth things. But we have it together now so that when I call or when she calls, you know, we can go through whatever emotional things we have to go through. And then we just get on with life because she's now raising her grandchildren because her daughter-in-law passed away with cancer as well. So it's really one of those devastating
things to do. She has a purpose.
Yes, yes.
You know, I heard you laughing over here, Leonard, but I just thought about something. I had a little bird wearing a retired cap on his head, like about you, in the green room. Said you were a bad patient. You told on yourself. So you laughing over here, but
Well, just real quick, there is that 1% of the male patients who have a biopsy that have issues afterwards. Boy, I was his worst nightmare, and it was not necessarily caused by the radiation. you know, a biopsy is not the easiest thing for a doctor to do, especially on a prostate. It's going places most people don't want to go, and so I developed a serious bout with sepsis, and unfortunately, I was in the middle of treatment with Dr. Adams, so I would go to him in the morning for radiation, and have to go upstairs for infusion of antibiotics. But yeah,
I see why you weren't a good patient.
no,
You weren't feeling very well.
I caused him a lot of grief.
Yeah.
No, he handled it. He handled it great.
Well,
Yeah.
see,
Like
there
you
you
said,
go.
it's very unusual, but you did great.
Yeah, I was that
Here you are.
1% that nobody wanted to see. So,
Well, you know, I love something you said earlier. I love everything you said, Leonard, by the way, you and Iris. But Leonard said, if you don't, basically, like an old commercial used to say, if you don't trust your doctor, you won't get well. Right. You know, this is part of the process. And with that in mind, we turn to you again, Dr. Adams, because I want to talk to you about maybe some of the trials or some of the research or something that you know from the medical end of things that are going on now with helping us in the race for a cure.
I think it probably relates to both prostate and breast that we're defining people who really need to get treated, who have aggressive cancers. I think 15, 20 years ago, prostate cancer, everybody would have gotten treated for every cancer. I mean, a little bit of cancer probably didn't need to be treating a lot of people. So I think we're defining the patient population that really benefits from these treatments that are not always the easiest. It's the same way with breast cancer. There are genetic tests to determine who's got an aggressive breast cancer. And we can pick that way and choose and select our treatments much better. So sometimes we can avoid treatments altogether, which, you know, if we can say that you've got a great prognosis without a treatment, that's an even better thing. And avoid all these things. You two have been through a long haul. You know, it's a traumatic road a lot of times, and frequently breast cancer, radiation's the last thing you go through. So I saw you were about at the end of you know, all your treatments. So hopefully that traumatic road is worth it. You know, in the long run.
Sure.
And here you are.
These are just two of your patients. Can you tell us? I mean, you've treated a number of them in a number of ways and with success, and maybe not so much.
You know, it's a cliche, but everybody's different, and you know, some cancers we can make predictions and they'll fool us. Some can't. You know, it's just you have to treat every patient individually and try and make the best decision.
Are we going in a direction of, you may or may not want to answer this, but are we going in a direction of medical breakthroughs and the latest in technology and things like that, where we'll be able to test in the womb, right? Maybe for...
I think that's hopefully the goal
That's
someday,
the goal. Okay.
and to be able to get a test even at a younger age. But yeah.
But not there.
I think we're a ways away from that, and
Right.
you know, cancer is part of our genetics, unfortunately, and there's so many different variations. You know, what makes it so difficult to treat and to cure each and every cancer. So.
And so what you see, Vicki, women coming in and doing mammograms and those sort of things are very anxious people sometimes women sometimes when they come in, they do have things like what Iris was saying, when they do have things that are suspect.
Right.
You don't necessarily give them that answer, that has to be read, but you probably see some things.
Yes, sometimes.
Tell us about that.
Sometimes we know when we see the picture, because especially if you've done it for a long time, you kind of know what you're looking for. And then a lot of times in our office, they actually have the first biopsy. So, you know, we are there when they get the results a lot of times from the beginning, and it can be tough because they're very scared and they hear the word and they're afraid, and you just have to keep reassuring them that, you know, they have a group of people with them that are going to get them through this whole process, you know.
And I said earlier, you have a very pleasant smile and demeanor and that sort of thing, but you actually, it's deeper than that for you. You actually have a passion for what you do.
I do.
Tell us about that.
I do. I've done mammograms for over 20 years, and through the process, I've had several friends, and actually a very best friend that was diagnosed with breast cancer under the age of 40. So this is something that's very dear to my heart, and I really do try to promote people getting breast cancer screenings and doing their tests. And I've walked the road with a lot of people, a lot of friends, and a lot of close friends, and it's hard. It's very hard, and I try to put myself in their place, and I try to give them, all my patients the same way that I try to treat my friends, to get them through what they're going through.
Right, that's good stuff right there. In closing comments, I want to give each of you a chance to just kind of make sure that for our viewers watching the Aware Show and hearing about survivors of breast cancer and prostate cancer and hearing about potential medical breakthroughs and what you do on the ground running right now and treating patients. And Hester, even you with the sister study and what you're doing ongoing to provide research for us to continue to win this race against cancer. What are some last thoughts that each of you have? We just have a few minutes here for each of you to have a closing thought. Actually, I'll start with you. Vicki, tell us.
I'd say, for me, the most important thing is just, not just breast cancer. I've had friends with all different kinds of cancers. My father-in-law passed away with colon cancer. I just say, go and get tested. Go get checked. Talk to your doctor about different tests and just do it. It's sometimes people are afraid to go do tests because they're afraid of the unknown and they don't want to know. But when you find out early, it's not a death sentence. There are so many things and there's so much technology available out there now that can help people, and no longer do you have to just think that you're going to die. You're going to be a survivor, and you can be around for a long time, and you've got family and friends that are here with you.
You said a lot. That's good. In essence, there's hope, and keep hope alive. Dr. Adams, last minute words.
Second that. Do what you need to do. Be your own advocate. Treatments are not nearly as bad as they used to be, and prognosis is better almost across the board. So.
And that's coming from your doctor. Thank you so much, Dr. Adams. Hester, closing comment?
Well, I found that having the digital exam as well as the regular Pressum, it has really helped.
Good.
And I did have another kind of biopsy when they saw a couple of things in my breast. Of course, that was frightening, but because of my own advocacy, I just said, okay, let's do it.
That we keep hearing that. Be your own best doctor. Yeah. Leonard, quickly.
Yes, be proactive, get those tests, and if they do come back positive, remember, you're not in it alone. So use all the resources you got, but the big thing is be proactive.
There you go. And Iris, final thoughts.
Everything that they've all said, but I also have to add that even once you've been diagnosed and it's behind you, there are so many resources out there. All you got to do is pick up the phone, call your social worker. There's a lot of programs out there to keep you active, to keep you, like this program right here. You guys called me. I love talking about it. It makes me feel stronger. But there's yoga out there. You could do yoga. You could just do, I could go on and on and on. There's just, and it's all Cancer Society promoted.
Very good.
And just make one phone call and you'll
can
just
do
get
it.
Yeah.
Thank you all so much for being here with us. I appreciate that. On today's program, we just tried to give you just a little overview of all of the resources and options available in the diagnosis and treatment of breast cancer. We hope this program will empower you to take control of your own health. Breast cancer is a fight we all must win, and so is prostate cancer. Awareness is key. I'm Dee Dee Sharp. Until next time, stay informed and stay aware.